Hi students, welcome to our session in oral pathology. I'm Dr. Kopi Krishnan discussing oral pathology with you. So we were discussing about odontogenic cyst and most important odontogenic cyst we have discussed in our previous videos that endanger as OKC, COC, etc. Now in this video we'll discuss the other cyst which is there in what can be seen in your MCQs. Okay, we'll have a small quick discussion on that. Okay, what are the other odontogenic cysts you should be knowing? Okay, the first one I wish to talk is your lateral periodontal cyst. Lateral periodontal cyst. Now, as the name indicate, now I think you are in a position that from the name itself you will catch that what the cyst is and what is a feature of this cyst. Lateral periodontal cyst means it is coming lateral to something in the periodontium, right? So lateral to what? Lateral to the roots. Okay, so see this radiograph. Okay, so this is a lateral periodontal cyst, means it is coming lateral to the roots of the tooth. You can see this radiolucency here. So that's a cystic radiolucency. Okay, that is seen between the roots of two teeth, lateral to the roots of two teeth. So from where this is originating, this is also originating from the rest of the dental lamina. Okay, most of all your odontogenic cysts are originating from the rest of the dental lamina, the rest of the so lateral periodontal cyst also originating from the rest of dental lamina. Okay, rest of dental lamina. And there is a very favorite site for this lateral periodontal cyst. Okay, it's most commonly seen in between first and second mandibular premolars. It is mostly seen between first and second mandibular premolar, the roots of first and second mandibular premolars. The second most common site is between first mandibular premolar and the canine. Okay, so this is the favorite site for this lateral periodontal cyst to occur. Okay, so this is just a favorite site. Now you know something, the cyst originating in the lateral side of a tooth root, it can be any cyst, right? Can't it be a radicular cyst originating in that side? Okay, it can be if you're given a radiograph like this. Okay, if you're given a radiograph like this, you can have a doubt that it is near to the root of two teeth, and it's a radiolucency. Can't it be a radicular cyst? It can be a radicular cyst, right? It can be a lateral periodontal cyst. Okay, and we have learned one type of OKC which comes in between the roots. Give an exercise to your brain. Okay, please give an exercise to your brain, the type of OKC which comes between the roots of the tooth. Okay, if you are not remembering, just go to the video of OKC, just revise it again. Okay, revision is the key. Okay, so we have a type called your collateral OKC. Okay, collateral OKC, that can also be this, that can also come in between the roots. But remember one thing, in lateral periodontal cyst, okay, this tooth will be vital. The tooth, both this tooth will be vital. Means it has no caries, no pulpitis. Okay, it is vital tooth. In collateral OKC also it is vital tooth. But in radicular cyst, that one of the tooth will be non-vital because the radicular cyst arise due to pulpitis, right? The caries which progress to pulpitis and then it forms radicular cyst, right? So this is the main thing. This is the clinical clue they will give you. They will give you the radiolucency like this and they will tell that the tooth are vital. Okay, please catch that point. Okay, they will say that the tooth are vital. So the tooth are vital means that that is not a radicular cyst anymore. It can be lateral periodontal cyst or OKC, collateral OKC, right? Then later they will give you the clue towards the question, right? Okay, then later they will give you the clue. What is that clue? Lining. Okay, the lumen is not that important. Lumen, there is no significant finding. Okay, see the lining features of this lining. You can see that it is having a lining of 2 to 3 layers. Okay, 2 to 3 or 1 to 2 cell thickness is there, and at a certain focus there is an increase in thickness. At certain focus you can see that the epithelium has increased in thickness. Okay, that areas are called plaques, or we say epithelial plaques. Okay, so the presence of this epithelial plaques is the important feature of lateral periodontal cyst. So that is the only thing we have to learn in this. Okay, there is nothing more. There is lumen lining and capsule. There is nothing much in a capsule. There is nothing more to read in a capsule. Capsule is not that significant. The importance is there in the lining. Can you see this? Okay, can you see that importance is there in the lining? There is epithelial plaques. Okay, so that is about your lateral periodontal cyst. Now, there was a question in your INICT. There was an IBQ, image based question. A lateral periodontal cyst, when we have multiple lateral periodontal cysts combined together, please listen carefully. When there is multiple lateral periodontal cysts combined together, okay, so that unilocularity is converted to multilocularity. So lateral periodontal cyst was a unilocular radiolucency. But when multiple lateral periodontal cysts combine together, they form a multilocular lesion. When they combine together, they form a multilocular lesion, radiolucent lesion. And that multilocular lesion will look like grapes. Okay, grape like. Okay, so we have one like this, one like this, one like this, one like this. Okay, that multilocular lesion is looking like a grape. That is called a botryoid. Botryoid odontogenic cyst. Botryoid odontogenic cyst is nothing but the multilocular variant of your lateral periodontal cyst. Okay, so just see whether the radiograph you are seeing is multilocular or unilocular. So if it is a lateral periodontal cyst, it is unilocular. When combined together, when it forms multilocular, it is now called as botryoid odontogenic cyst. Means it is looking like a bunch of grapes actually. Okay, so multilocularity will signify botryoid odontogenic cyst. Okay, so that is one thing. Now the second cyst, you know, so you see this cyst. Okay, can you see this cyst? Okay, this cyst is on the gingiva. That cystic thing is on the gingiva. Now this is called a gingival cyst. Gingival cyst. Okay, so gingival cyst of adult, gingival cyst of infant. There is two different names is given, but anyway, it is gingival cyst. Either it is coming in the adult or it is coming in the infant. This is gingival cyst. Now, what is the peculiarity of this gingival cyst? Why we want to study gingival cyst? Gingival cyst is actually similar to lateral periodontal cyst. This also have epithelial plaques. Okay, epithelial plaques are also seen in gingival cyst and lateral periodontal cyst. But the lateral periodontal cyst comes in the bone. Gingival cyst comes in the gingiva or in the soft tissue. Okay, the gingival cyst comes in the soft tissue. Lateral periodontal cyst comes in the bone. That's why there is radiograph. Gingival cyst doesn't have any radiograph because it is coming in the soft tissue. So we can say that gingival cyst is actually a soft tissue counterpart of lateral periodontal cyst. That was the question. That was the question in the NEET examination, that how gingival cyst and lateral periodontal cyst are similar. Okay, the gingival cyst and lateral periodontal cyst are similar because both are arising from the rest of dental laminae. Okay, both are odontogenic cyst. Both will look like similar. Both will look similar in the histology because both has epithelial plaques in it. Okay, so that is lateral periodontal cyst and the gingival cyst. Okay, hope you understood. See how easy we can remember things. You can combine lateral periodontal cyst with the gingival cyst because their histology matches. If lateral periodontal cyst comes multilocular, it is botryoid odontogenic cyst. Okay, see how it matters. Okay, so this is next cyst. One more cyst I have to discuss, that is glandular odontogenic cyst. Now, glandular odontogenic cyst is very easy. I know that now you are in a position to identify the feature of a cyst from the name itself. Glandular, gland, something is related to gland, something related to gland. Gland, what you see in the glands, you see ducts inside the gland. Right, you see secretions inside the gland, ducts inside the gland. So what is the peculiarity of this glandular odontogenic cyst is that it is very aggressive cyst. It is very aggressive, and what you can see is that in this cyst you can see the lining. We have a lining here. Okay, in the lining you can see duct-like spaces. Okay, duct-like spaces you can see. So much of spaces which is filled with some kind of mucinous material, that is duct-like spaces. Okay, this is one thing you can see in glandular odontogenic cyst. Okay, and what other features you can see in the glandular odontogenic cyst is that glandular odontogenic cyst will look like a mucoepidermoid carcinoma. Okay, so there is a very big confusion that how to identify GOC, glandular odontogenic cyst, versus, okay, mucoepidermoid carcinoma, MEC. It is very difficult to diagnose actually. So there is a criteria for that that was given by uh,